right. All right. Happy Monday to you all who are tuning in. Thank you for joining us in our next installment with our In Bloom Political Education series, a series that we have been doing throughout this summer to really delve into topics related to our policy priorities and really just issues we're looking to explore more along with our supporters, topics that people have brought to us as well and wanted to dig more deeply into. So I'm Briana, she, her pronouns, the executive director at Healthy and Free Tennessee, a statewide reproductive justice organization working to grow the movement across race, gender, and class. And I am so excited to be in conversation today with Johndee and Jeff, and we'll be talking more about TennCare, kind of like a one-on-one about TennCare. Last week, we were in conversation with someone at the Tennessee Justice Center, and she really provided a broad overview of public benefits and mentioned SNAP and TennCare as a part of that overview. And today, we're going to dive more deeply into TennCare. What is it? What do things look like, especially as there are a lot of changes that are happening at the federal level? And really are going to get into what does that look like in Tennessee and what can people be expecting and kind of like looking out for. So yes, today joined alongside Johndee Breedlove, who is a full spectrum doula, public health professional and health educator, and also Jeff Strand, who is the Assistant Director of Government Relations at the Education Trust in Tennessee. So I'll pause right there, and Johndee and Jeff, I want to give you all an opportunity to share a little more about your background and how you arrived into this conversation, and then we'll get into the questions. So I'll start with you, Johndee, first to share a little more about yourself to our supporters, and then I'll pass it to you, Jeff.
Okay, well, hello everyone. I am Johndee Breedlove, but I go by Dee Dee, so please call me Dee Dee. I am a full spectrum doula. I've been a full spectrum doula for about 3 years now. I received my training through Homeland Heart here, located in Tennessee, during my Master's of Public Health program through Meharry. Graduated from both programs, so I've been hitting the grounds running with public health and all things maternal and infant health, especially related to underprivileged, underserved, and minority populations here in Tennessee, particularly in Middle Tennessee. So yeah, that's a little bit about me. Jeff.
Thank you, Dee Dee. So my name is Jeff Strand. I am currently the Assistant Director of Government Relations at the Education Trust, but much more relevant to this conversation, about a month ago, I was the Director of Public Policy at the Tennessee Disability Coalition, and I've been in that position for about 5 years, really spending a lot of time interacting with TennCare across its various iterations. And so I am excited to talk a little more about it.
Yeah. Thank you all so much for sharing a little more about yourselves. Dee Dee, we love Homeland Heart. I did birth training. This was like 2020, I want to say, before the onset of the pandemic, but we've been connected to Krista for some time now, and know that we'll talk more about doula care, and also big fans of like the work that the Disability Justice Coalition has been doing. And yeah, just really appreciate your expertise and what you'll bring to this conversation. And so, Jeff, I want to start with you first and really start the conversation at like, what is TennCare? If you could share more about what is TennCare and also what qualifies a person for TennCare. So, what is it and eligibility as well?
Yeah, absolutely. So TennCare is Tennessee's state Medicaid agency. Every state, all 50 states and DC have a state Medicaid agency that's responsible for administering the program. So you got a couple different tiers here. You got the Centers for Medicare and Medicaid Services, CMS, up in DC. Their job is to set rules and send out money. And so our state Medicaid agency gets that money and follows those rules and establishes programs for people to receive health care. And so that's really their primary purpose, is to convey the Medicaid program through the lens of Tennessee to the population that are eligible. To be eligible, you can arrive there at a couple different ways. So primarily from my public policy of or director of public policy from the Disability Coalition, we worked a lot on the disability side. So you can almost think there's two sides here. You've got TennCare Standard, then you've got TennCare for people with disabilities. And so for people with disabilities, there are several waiver programs. CMS sets the rules and then say, hey, how do you want to break them? And we write all that down in a waiver and we send it back and they say, yeah, that's cool. So it might be a waiver from like cost caps, stuff like that. You can't spend more than this much on a certain thing. So if you have a disability, you have to be it has to be considered medically necessary to get a service that TennCare for people with disabilities provides. They provide that through their waiver services, ECF choices, and then a bunch of closed ones that were too generous, so we decided we were going to close them. And then on the TennCare standard side, it is much more just like health insurance. So the disability side, you get some insurance, but you also get a bunch of these services. On the standard side, it's pretty much just health care. And so to be qualified for that, you could be a pregnant person who makes under the income and asset threshold. You could be a child, and a big number of children in Tennessee are covered by what's called Cover Kids, is our state Medicaid agency through the CHIP program. You could have a disability, or you could be aging to qualify. But the big thing that you need to know about who is qualified for TennCare is it's all about how much money you make and how many assets you have. And it is a criminally low threshold for both of these things. It's a little bit dependent on who you are. Like a pregnant woman can be up to 250% of the federal poverty line. A child can have parents who are up to 300% of the poverty line. So it's a big spectrum, and they make it really complicated for you to know. So that is broadly what TennCare is and who is allowed to have TennCare.
Yeah, thank you for that, Jeff. And just a quick follow-up question, because I know when I came into this work many moons ago, people were talking about expanding Medicaid in different states, expanding Medicaid, like kind of shifting a little out of the Obama administrations when, I came into organizing. And so just quickly, could you just share, Jeff, like what do people mean when they talk about like, okay, what states have expanded Medicaid, and TennCare being, our state's Medicaid program, and what that looks like in Tennessee? Because I think people are asking these questions, especially as they're paying attention to what's happening federally.
Yeah, so Medicaid expansion was an option introduced in the Obama administration that would allow people who need health care to qualify up to 138% of the federal poverty line. So if you're not a pregnant mother, you're not a kid, you don't have a disability, it, Medicaid had traditionally been only be available to you if you were 100% of the federal poverty line. That's how it still is in Tennessee. 41 other states in DC all decided that they would take the federal government up on their offer and expand Medicaid eligibility to 138% of the federal poverty line. That meant anybody who fell under that was also going to qualify for TennCare. Remember, that's just you're not an aging person, you're not a kid, you're not pregnant, you don't have a disability. This is just you need health care. And so one of the reasons that Tennessee decided they didn't want to, or so said that they didn't want to expand Medicaid and opt into that, was they were worried that at some point the federal government would stop funding it. And we as advocates were like, that's absurd. Who would do that? That's crazy. You put that into statute. So many states rely on that. And lo and behold, the unthinkable has come to pass. And much of the federal undoing of the ACA, the Affordable Care Act, Obamacare, is to essentially defund the expansion population. They're not going to pay the same rate anymore. The Biden administration had offered in this really nice like bonus payment for states to newly expand, and that would have conveyed about $1.3 billion over 2 years to the state of Tennessee for the Medicaid population, but we opted out of that. They've also sort of defunded the exchanges too, which is not TennCare. It's like the step up from TennCare. So you're not just limiting who can be enrolled in TennCare, you're limiting who can find affordable health care above that level. And so that is essentially what we mean when we say expansion.
Yes, yes. Thank you so much for adding on to that and like what is meant by expanded Medicaid and where Tennessee is when it comes to, other states, 41 other states in DC. So I really appreciate that. Dee Dee, I want to turn to you next. So we know when it comes to TennCare, and thank you, Jeff, for like lifting up like the groups of folks, including like pregnant Tennesseans who would be eligible for TennCare. And we know that TennCare covers 50% of births in the state. But given that, we also understand that there are barriers. And so, Dee Dee, what would you say are some of those barriers to care for pregnant Tennesseans? Like, what barriers do they face with trying to like access TennCare or just being on TennCare, in general? And how do you and other doulas support pregnant Tennesseans with overcoming these barriers?
Well, there's a lot of barriers, unfortunately. Um, the list is endless at this point, but a couple of barriers would be like limited provider networks, just having a limit on the amount of what provider you can go to in order to, receive prenatal care and even deliver your baby, especially in rural areas and communities outside of Nashville or Middle Tennessee. Transportation challenges. Majority of these women who are on TennCare do not have a car. So they don't have access to even be able to make it to their appointments to be able to get adequate care. You have restrictions on, the requirements they need to make in order to even qualify for TennCare. I've had a number of clients who are unable to even get TennCare because they just don't meet the basic requirements. However, they don't make enough in order to provide themselves with, private insurance. um, Lack of culturally competent care, or coach. My new term is culturally aware care or culturally awareness. Delays in scheduling appointments or not being able to even reach their provider due to um, the amount of people each provider are seeing on a daily basis with TennCare. And honestly, a lot of my clients just have a lack of awareness to their coverage or like any services that they'll be able to be rendered through TennCare. I know a good majority of my clients don't know that, through TennCare you can get free diapers up to a year, after, up to a year you have your baby. It's constantly like an educational stance that I have to take in order to allow my clients to know what exactly is covered through TennCare or even how to navigate, health insurance or the health insurance here in Tennessee. There's a lot of ways that me as a doula and other doulas here in Tennessee who are helping mitigate that barrier for a lot of our clients. A lot of times I will sit down and just, print out your coverage. Let's sit down and see what are your benefits, how can you utilize your health insurance in order to navigate the healthcare system and get the necessary services that you need. Even providing like a advocacy, taking an advocacy stance in terms of like their medical visits, explaining what the doctor is saying, having them understand. Because, when you're at a doctor's office, sometimes, most of the time, like the doctors sound like they're talking at you and not really having like a robust conversation. So just being like that mediator in between doctor and client to have them understand like, okay, this is what the doctor is saying and here's why. Oh, it's because your levels are low, or, it's because it's too high. And just providing a medium in terms of, oh, here's some natural remedies that you can do before we can go ahead and do the medical route of intervention. And also, like on the flip side of barriers, is like the over intervention, over treating, a mom, where, birthing is a natural thing. It happens, it's natural. It happens in the wild all the time. And, we're at a stance where, people want to overtreat so they can build the insurance as much as they can in order to get that payout. So just being able to be that medium and like, okay, we don't need this laundry list of interventions right now. Let's try to do something else and see if we will be able to get to the same result. Um, and also just connecting, being a resource and connecting to local communities within or local organizations within Nashville or in Tennessee general that provide services such as like free transportation. I know that the Hope Clinic allows, whoever is seen at the Hope Clinic will have access to get transportation services to come to and from their appointment. And just the continuous education and emotional support just to improve maternal and infant outcomes here in Tennessee.
Yeah, thank you for that, Dee Dee, and just like uplifting the critical work of doulas, especially community-based doulas. And
Yeah.
so in this the past few years, well, almost 5 years now, we've been working on expanding doula care, and I'll mention that toward the end when we talk about advocacy and what people can do to better advocate, on this issue and others. But we've been really focused on doulas, like really pushing for doulas to be eligible for TennCare reimbursements. And I know there are other birth workers who, over the years, like midwives who, now like are receiving reimbursements, and it's like a lot of different things that go along with that. But we think it's still like a vital option, and I really like appreciate you like uplifting how y'all are caring for your clients, like in addition to like attending the appointments, like, oh, let's print it out and see what your coverage looks like, and kind of going over that as well, and trying to connect
Yeah.
them to like these other community resources that exist to help with some of these needs, to maintain like a healthy pregnancy. So I really appreciate you
Yeah.
lifting it up.
Thank you.
Yeah, yeah. And so I guess like in and of itself, like you like through that, you were talking about like resources that exist that support Tennesseans with like navigating some of the issues with TennCare, or just kind of understanding like what the coverage is, like you already mentioned,
Hmm.
Dee Dee, that a lot of doulas support with. So I just wanted to open it up, and really curious too, Jeff. What resources would you say exist to support Tennesseans with navigating issues with TennCare? And if you want to uplift any other barriers, in addition to what Dee Dee shared, that would be great as well.
Yeah, thanks. Yeah, I really want to highlight a barrier that Dee Dee talked about, that is huge across TennCare, and it is like the fundamental rot of TennCare is its reimbursement rates. We could talk about access, we could talk about exclusivity, we could talk about how poor you have to be to qualify. But really, even for the folks that qualify, it is hard to find a provider for anything. Like anywhere from primary care to pregnancy, all the way to the most complicated disability tasks. They just don't pay enough for providers, doctors, therapists, that kind of thing, to want to participate. They lose money often on participating in the state Medicaid program. And reimbursement rates is entirely a choice by TennCare. They can set them. They can't. There's a cap on it, but there's no bottom, and we pick as far down to the bottom as we could possibly get. And one of the biggest culprits is the way that we've written our TennCare 3 waiver that emphasizes something called shared savings. And so shared savings is essentially you get a big pot of money from DC to spend on your population based on how many people you have enrolled. Shared savings, and no other state has this but us, means that if we don't spend some of it, we get to split the savings with DC, which incentivizes us to not spend it, because then we can turn around and pay for political projects. But that is my digression on my greatest gripe with TennCare. Resources, though, this is my second greatest gripe with TennCare, is there just aren't very many of them out there, and they're usually an organization like the ones you see here, right? It's not TennCare telling people how to get on TennCare. They do have an app called TennCare Connect. It is not helpful. The portal is problematic in many ways. But one of the organizations out there that I'll just highlight, and then I'll go on mute here. is the Tennessee Justice Center. I heard you mention them earlier. They do a lot to get folks connected to help kind of demystify this process of getting enrolled in TennCare. And they're full of lawyers. And I love a good lawyer because they are holding the state accountable for their eligibility practices. And so currently they're suing the state for their redetermination practices. And so every year when you're on TennCare, you got to go back through and say, yes, I am still poor enough to qualify, or I'm still disabled enough to qualify. And it is a process that is fraught with pitfalls. You know, it's really hard to do, and it's not supposed to be. And so currently, the Tennessee Justice Center is suing the state to say, "Hey, you are making this too difficult." And you know, thinking of the new federal changes, that's going to have to happen twice a year now, that redetermination process. So they have a portal on their website that you can go in and say, "Hey, I'm having this problem and this problem and this problem," because it's probably more than one problem with TennCare, and they'll send a nice lawyerly person at some point to come talk to you and see if they can help you out. From I said one, I'm going to say two. This one's super fast. From the disability side, it's Family Voices of Tennessee. They do a great job connecting parents and caregivers of people with disabilities to each other and helping navigate the disability side of things.
Yeah, there are two things that come to mind. One, and Dee Dee, you lifted this up as well about like the issue of providers because I was in conversation with my sister a few months ago and I have three nephews and the youngest just started kindergarten today, but with my oldest nephew, he's 15 now and he's in 10th grade. When she was pregnant with him, she was on TennCare, and that's something that was like a big issue for her. Like she wanted to go to a certain provider, but wasn't able to. And I
Mhm.
have like a few friends who also have been TennCare recipients, and that's something that they like brought up and how like that really just impacted their experience. And as we think about the reproductive justice framework, and even if just, thinking about birth and, the human right to have a child and birth and the conditions of the resources and services of one's choosing and, being able to choose your provider, but not being, if you're not able to do that because you're on TennCare in a lot of ways, that's kind of what's happening. That's at play. So
Mhm.
pregnancy and then beyond, how that becomes an issue. And I just, think that's just I just really appreciate both of y'all speaking today because I think sometimes people, especially like if you aren't a TennCare recipient yourself or you don't know anyone who is on TennCare and like navigating these barriers, like people don't think about that. They're like, well, yeah, can't you just go to this person? It's like, well, no, like they, like, and so there's one person I'm thinking about in particular, and like now she has a child who's much older, and just like the things like she's just talked about. And so
Yeah.
and just the provider piece, it's so critical. And I think again, like just different people certain people
Yeah.
might not know this. Really appreciate y'all both speaking to that aspect of it, because yeah, sometimes people just make assumptions like, oh, you have health insurance, and it's like, yeah, like when we talk about quality care and like robust options that should be available to all of us, regardless
And
if we
it's not.
have insurance. Yes, exactly.
Unfortunately, it's not. I tell my moms all the time, like with TennCare, you're gonna jump through some hoops. I'm sorry in
Mhm.
advance, but you have to boots on the ground. Like you have to really jump through hoops and really advocate for yourself and fight for a lot of the resources or coverages that you technically supposed to have, stated in the print, but on your, benefits tab. But unfortunately, that's just the climate of where we are right now, and not really much change has changed over the past couple of years since since your sister had her baby at 15. Now he's 15. Things that are happening when a child was 15, when they're just coming into this world, are still happening to this day. And it's just so unfortunate for, a lot of pregnant women here in the States. Um, but to piggyback off of what Jeff was saying, there are some resources to help people navigate issues with TennCare. I know particularly like the Hope Clinic is one major, or like even Matthew Walker, I believe they have staff who will help clients speak about their coverage, or get the necessary help that they need in terms of resources with TennCare. Also, you have, our local health department. They have, they have people who are designed to help people navigate TennCare and their coverages and what resources. And they also provide like that. Like a resource, like wherever TennCare falls short, I'm pretty sure the health department has some type of resources available that will help, negate that issue that they're having with TennCare, as well as, the plethora of organizations here in Nashville help mamas navigate TennCare and just the lack of resources. So in terms of like doula care, you have Blissful Births, you have Home and Heart, you have the Tennessee Doula Association. Those are all doula organizations where moms who are interested, they're able to get a doula at a low to free rate. And I try to push it out there to all moms. I'm like, please, if you live in Middle Tennessee, look up these organizations. Like now we're getting to a point where doula services aren't necessarily a luxury, is a necessity, especially if you are, under you're at the even if you're at the line, even if you're middle class, unfortunately, I strongly advocate for them to go ahead, especially a pregnant mom, to go ahead and get a doula, because you just never know, especially the current climate of Tennessee. And unfortunately, Nashville particularly have one of the highest maternal infant death rates in the nation. When you compare it to all 50 states, in this small city has the highest, death rate, is so alarming. So, yeah.
Yeah, yeah. And several doulas that we have partnered with, encountered over the years, they, have lifted those things up as well, DD, and just like, yes, like everybody. Like I have some people I know pregnant. I'm like, yes, you need to do it as well. So
Yeah.
again, just like appreciate you pointing back to like this kind of like comprehensive care that doulas can offer clients. So yeah, really appreciate that. Um as I mentioned toward the beginning of the conversation, there's a lot happening. I mean, in Tennessee as well, but federally, there are a lot of shifts that are happening. People like, having questions. We got into it a little bit last week with Jane at the Tennessee Justice Center, like, oh, these changes that are happening federally, the big beautiful bill, like, how is that going to impact Tennesseans? And so, yeah, my next question is related to these recent changes. How have they impacted, or how will they impact access to TennCare for Tennesseans?
I believe the bill would negatively impact Tennesseans, but I'm interested to see um, how the community uplift what's about to happen. That's kind of where I am. I know it negatively impact in terms of like it's just going to reduce the amount of women who just have access to health insurance. Now, a lot of moms will, when they have their baby and they have their baby at the hospital, they'll be getting that $30,000 bill sent to their house instead of sent to the insurance. Um, Especially when, you're dealing with a mom who doesn't have any coverage whatsoever, and they're in a state of where they don't have any transportation. They don't have access to, a delivering doctor. Like, yeah, you can go to the Hope Clinic, but you still need a provider that's going to deliver your baby at the hospital. Um, and unfortunately, it's just going to widen that gap that we spent decades trying to close or shorten is just going to return right back to where it was. I'm Gen Z, so it reminds me of like, oh my gosh, all my ancestors, like Martin Luther King, have fought for us to get to a certain place. Now we're going right back to how it was decades ago. But on the other side of it, I'm interested to see how the community comes together and uplift, a lot of these moms who do not have access to care. Even before when we had these such wide gaps, we have organizations that are established here in Tennessee to help negate and fight back those shortcomings that, are provided. So with the negative impact of the government and the lack of support for their people here, especially in Tennessee, I think it will also, create a rise in us taking care of one another, honestly.
That I love that optimism. I see. I wrote down a list here, and it's all bad stuff. But first, shout out. I didn't know y'all had Jane on last week. Jane
Yeah.
at TJC is who I call when I need someone who's way smarter than I to tell me how something works because she knows everything. So
Yeah,
kind
she
of
was
a
incredible. Yes.
yeah high bar to clear here. So I've got some bad technical things that are about to happen. I think
Mm.
the big picture thing is the way that and I'm not even going to call it that, the reconciliation bill changes things in Tennessee will result in lesser access to care, smaller scope of care that you could possibly get, especially for folks with disabilities, and just a lower level of quality. Right? There'll be a lot of people who are forced to go to providers they maybe wouldn't have chosen otherwise. And then thinking again, big picture, but at the state level, is this going to be a budget buster? And I'll say a couple reasons why here. So first, the thing that's going to be really difficult for folks is redetermination. Like I was saying earlier, the state of Tennessee is already under suit for how hard it is to maintain your eligibility from one year to the next. And even then, even if it was easy as it could possibly be, it's strict. If at one point they do a check on your assets and you've got $2,001 in your checking account, they're going to boot you instantly. And then you've got to go through the whole process to get back. So all of that stuff with how hard it is and how strict it is now going to happen twice a year. And not only is that going to be really difficult for people to maintain eligibility or maintain enrollment, even when they're still eligible, it's going to be a ton of money. Redetermination is hard and it takes a ton of TennCare employees to do. You're going to need twice as many of them now. So we'll be taking Medicaid funding that should have been for care for people, and they're going to spend it on administration. And that, if you ask me, is not very doji. And I thought we were in a doji place right now. One of the big things, and this is going to be what limits access and scope, but also is the budget buster, is limits on provider tax. And so provider taxes are taxes levied by the state onto healthcare providers like doctors and clinics and things like that. And so in our state, we provide our provider tax is the highest it can be. And so that sounds bad. You'd think the doctors don't like this or whatever. No, it's actually a good thing, right? Because that pays for part of the state Medicaid portion that they have to pay. So zooming really big out, feds pay about 65 cents on the dollar. Tennessee has to cover the 35 cents of that. You can double maximize the impact of your state funds if it comes through provider taxes, because that just turns around and goes right back to the provider anyway. And so they want to spend less of the state money in getting that. So all that is to say is we're at 6%. The new bill caps it at 3.5%. And there's no way for us to make up that money except out of the general budget, right? Or you could decide we're going to limit access. We're going to limit the types of care we provide. We're going to lower our reimbursement rates somehow, but they're going to have to account for this. And Tennessee is not ready for that. And so there'll be fewer providers, fewer services. It's going to be a disaster. Expansion funding, I mentioned that before. We've all but foreclosed any possibility that TennCare expands Medicaid anytime soon. It's just not happening. If you are not on TennCare, but you're really close, you previously could buy healthcare on the marketplace exchanges that were set up through the ACA. They took away the stuff that makes that affordable. So now it's just as expensive as every other mark or plan out there. Like if you just went through Blue Cross Blue Shield, you used to have a thing called premium tax credits that paid for a big chunk of that premium. Not anymore. And so all that is to say is that that bill that just passed, the one big ugly bill, is the most destructive thing to Medicaid since its inception. And there's a lot of things that have been bad for Medicaid. The managed care systems going down that route. this is the worst thing that has happened. And, I think the most invidious part of this is that none of this stuff is going to hit till after the next elections. So people are already pissed about this. They don't like it. It's unpopular, but it won't hit them in their pocketbooks or their general well-being and health until 2026, 2027, 2028. And then, there'll be no accountability for it. So that was a lot to say. I'll leave it at that.
Yeah, thank you for painting that picture. And that's what we want our supporters to know, though, like, like materially, this is the impact, this is what we're up against. And with that, to what you mentioned, Dee Dee, around like how we're taking care of each other, I hear that it's like, okay, how are we pushing back against this? How are we resisting? Even th that might be like mutual aid efforts, but also like how we put in pressure on like elected officials or just like these systems overall to really fight for the care that we deserve. And so Healthy and Free is a very much so single payer system, Medicare for all type of organization and trying to push for that. And as we like hold that and just like see like all these barriers that exist, without this bill and the barriers that and challenges and just like people just losing care, bottom line. And when people don't have access to care, that is death. Like we're very clear about that, about people will lose their lives and it will have like a drastic impact on entire communities. And we also are thinking about rural communities as well as we already know like what things are looking like in lots of rural areas and the hospital closures. And we talked about that a little bit last week as well. And so, given what we're up against, this next question, next to last question, it's just how can people get more involved with these issues? What would y'all say are the best ways for Tennesseans, people who care about these issues? How can they like learn more about it? The resources available. So it's like, how can they get more involved and push back, but also like going back to this earlier point, like lots of folks don't necessarily know like the system like in and out. Like, okay, this is actually, how to support somebody with like they could like checking their eligibility with TennCare. So what resources exist for people to kind of learn more and how can people become more involved in these issues and pushing back on some of these horrendous things that are coming.
I know of a few organizations. I know personally for me, I've gotten to do a lot more work with the Tennessee Justice Center and in terms of just educating the community from a doula perspective on or like maternal and infant health, advocate in terms of, how they what they can do in order to, fight back against these changes. I know that the TJC have weekly sessions on Wednesdays that provide like a robust understanding of like Medicaid funding, how the bill is going to impact Tennessee and the people who utilize TennCare. So you have organizations like TJC, you have Healthy and Free, just hosting something like this and publicizing it to the community alone helps, people sit down and listen and understand like what exactly is going on. I know attending legislative sessions can be very daunting to a lot of people. I've attended my first one earlier this year because I'm trying to pivot into the policy world. And I was like, oh, this is very eye-opening. But I suggest, especially, you know, people that look like me, I highly suggest to attend a legislative session um, because it opens your eyes to not only like the terminology and the jargon that they use in order to, get things passed or voted on, but also it provides people an opportunity to understand the demographic, what exactly is going on in Tennessee and who the demographic is voting yes or no pertaining to our rights. Um, Also, just getting getting themselves into these type of workshops where, like, I know the Equity Alliance provides workshops and trainings for people who want to get into advocacy work and help them leverage their skills in terms of, learning how to email our state senators, email our state leaders, how to engage with different conversations with, community leaders, so they can spearhead movements in terms of, mobilizing the community and taking it to the hill and and educating our Tennessee leaders on what is going on in Tennessee, on at the community level, and how their decisions are impacting Tennessee as a whole. And also you have, smaller organizations that have small groups for their group. I know particularly for me, within these past couple of months, I helped find a group for minority and underserved, well, minority doulas, and provide necessary trainings that they can give to their clients to, empower their clients to reach out, to complain. Because, a good majority of people do not complain to the insurance about their grievances. They're more so to just answer the phone with attitude and hope that the person can help them. So, just having them understand, like, the how to even submit a grievance, how to email a senator. You're supposed to call your state leaders. That's a part of their job. A lot of people are like, no, I don't want to call them. They're not going to answer. Who cares? Leave a voicemail. So, definitely in terms of, there is a lot of organizations here in Nashville, particularly, who are now getting to a point of pushing the community to speak up and voice their concerns. And I'll list a couple of them, but I feel like I left a good amount off my list, and I'm sure Jeff will be able to fill it in. But yeah.
Yeah, thanks. I'm going to echo something you said, Dee Dee. I have spent the last 5 years in, disability policy making and advocacy, right? And so to me, and I'm going to butcher this metaphor. When you're a hammer, everything's a nail, or something like that. So when I think about what to do here, I think, okay, yeah, what Dee Dee said, go to the legislature. Um, and I'll tell you something. They don't know anything about this. And so they have this kind of magical depiction of TennCare as this like miracle state agency, that they are the model, that we lead the nation. And yes, we do lead the nation in restricting care, right? We lead the nation in eligibility redeterminations where they kick people off who are eligible. And so there needs to be a narrative shift that happens about who TennCare is. And they're very proud of their shared savings system. But I think they need to recognize that every dollar saved is one we chose not to spend on a person in TennCare, right? This is not through some sort of you know doji maneuvering where they found an inefficiency and fixed it. No, this is because you denied someone access to care, right? Or you denied their eligibility. You kicked them off, even though they were still eligible. That's where all that money comes from. And they're starting to get it down there, but that's what really needs to happen is folks need to go down there and show their face. This is who TennCare is. This is what's happening to me. They are happy to talk about anybody on TennCare in the most derisive terms you can think about. It's a lot harder to say it to the face, right? So go down there and show your face and make it more difficult for someone to caricaturize you, right? Tell them that TennCare is restricting access to this care, right? And find organizations that are doing this stuff. TJC is going to get all the love here. TJC is doing this stuff. Um, but it's healthy and free too. You got to know this stuff. You're already the expert. You should start lapping them in your expertise. And that requires getting into what's broken, right? Because you can go in and say it's broken and show it's broken, but you got to come with a solution too. And it could be, higher reimbursement rates, or it could be provider bonus sign-ons. Like if you become a new Medicaid provider, you're going to get a little money or something like that. But then it's also highlighting that all this bad stuff is coming down the line, and it's going to get worse, and we can't wait for that to happen before we act. So we need to get TennCare to shape up, stop leading the nation and all the bad stuff, and get ready for how you're going to ensure that everybody's currently eligible, stays eligible, and can get care, and how those folks that are sitting there waiting on a wait list can get in and get some care too. But I think we're both saying, you got to go down and make it human.
Yes, make it human and share like the real faces behind like yeah, who's accessing it, and coming to y'all's point that, it's not what folks as far as like how to actually get care. It's not what like folks might think about, like this, fantasy. And so I really appreciate that. And yes, we have a new legislative year coming up in January. And so I'm not the policy person, but to y'all's point, like there is something in people reclaiming power and just being there, because going to the legislature, going to Cordell Hall, can be so inaccessible. And so, like, we do like Days on the Hill, and I know other groups do Days on the Hill, but like just going and speaking with your rep and senator, and like, I'm your constituent, and like, I'm voting for you. So like these are the things like you need to listen to my concerns here. So like I appreciate that. It's like the many ways that folks can advocate. And again, just also want to lift up this community care, mutual aid piece that you mentioned earlier, Dee Dee, and how community-based doulas are a part of that. But also there are these other like networks, and we've seen that in a lot of ways, especially when we think about disability justice groups and mutual aid, and not just with, in 2020 with the onset of the pandemic, but just like how folks have like found ways to care for each other and support people and, get into visits, transportation, other things because of the gaps in these systems. So really appreciate this like last note that y'all shared about how folks can get more involved, like what people can turn to. So really am grateful for y'all taking the time to be in conversation with us today, Dee Dee and Jeff. And there are just a few things that I want to uplift for our supporters, because there are things that we have coming up, and also just like want to share again like our work with reproductive justice and this like connection to TennCare. So in addition to the expanding dual care work and TennCare reimbursements, and Jeff, what you already said about like, hey, the reimbursement rates need to shift, and how can it be like an option for these folks who like providing like, so such critical care to communities? How can, that be an option for them to receive reimbursements? So that's something that Healthy and Free has been working on. And we also have been thinking about expanding access to birth control. And so we had a very huge win last year with working on legislation related to people who are, accessing birth control to receive like a 12-month supply at one time. And, as we think about inconsistent access and, being kicked off, and then also like the care that's available in rural communities and people having to travel like long distances, we knew that, this is something that could be helpful, if they already have like a prescription that's written for a 12-month supply. How can they like receive that, get that dispensed at one time? So we're really happy about that. And this year we've been working a lot on implementation. And so we have an event this upcoming Sunday at 5 p.m. Central, 6 p.m. Eastern, and it's a text banking event. And so we're going to work on texting about 50,000 Tennesseans who might be eligible for this new benefit to receive a 12-month supply of birth control if they are enrolled on TennCare. And so we have the registration link in our bio, and it's also being dropped in the comments. So as people think about like, ways to get involved, advocacy, when a bill is passed, implementation is huge. And sometimes like we forget that, or like how to like think about like rulemaking them and all that. That's one piece to implementation. But if it's something like this, with the wins that we, are trying to get, how do people like know about these different benefits? So if you're interested in being a part of this event this upcoming Sunday, to share about the 12-month supply of people who are enrolled on TennCare, visit our bio. And we also will be continuing this In Bloom education series next Tuesday and digging into food policy. So join us next Tuesday for a conversation related to that. So yeah, thank you all again, and we'll make sure that all the resources, links that that were implied and what you all share gets out to our supporters, and we're just grateful to be able to continue to build and have these conversations, and look for other ways to partner and to collaborate, because we really are trying to like build deeper connections and also kind of break up some of these silos, because sometimes we've seen it like people can be over here if they're doing this particular issue, but we see reproductive justice as being this connective force, like, okay, this is how this is a reproductive justice issue, and how we can build better bridges. So with that said, again, thank y'all for being here with me today. I really appreciated everything that y'all shared. And yeah, we just continue to like share information with people as one step in shifting these conditions that we are experiencing. So thank you all for tuning in, and we'll be in the series to continue on with the series very soon. So thank you.